I just wanted to spend a few minutes and talk about a disease that I have a lot of experience managing, and that's acute pancreatitis. Acute pancreatitis you might have heard about. It's currently actually the most common GI disorder prompting admission to the hospital. And we're seeing it with increasing frequency. Acute pancreatitis essentially is an inflammatory process of the pancreas. The pancreas is an organ that is in your abdomen. It sits behind the stomach, and it has two jobs. The pancreas has an endocrine function, which means it makes hormones. Most commonly, the one we might have heard of would be insulin, and insulin regulates your body's blood sugar. That's why when people have issues with the pancreas, you might see that they develop diabetes. The pancreas also has what's called an exocrine role, and the pancreas essentially makes the digestive enzymes that are released into your intestine and assist with digestion of food that you eat. Those digestive enzymes are very important to us when they're in the intestine, but when they're still in the pancreas and they become activated, that's when it runs into a problem. What we see is that the enzymes actually will digest the pancreas itself, and that causes a lot of damage to the pancreas, and it sets off an inflammatory process that can make the person very sick. So some of the things that we might see cause pancreatitis include gallstones, alcohol, high triglycerides, and many other rarer factors. There is something called idiopathic pancreatitis, and with idiopathic pancreatitis, we don't really know what the cause is, but it's likely that it's a genetic cause. There's familial pancreatitis that is usually a disorder of the enzymes that people are born with, and then there's other rare causes like high calcium levels, viral causes, and other kinds of toxins that might cause pancreatitis. In any case, we see a pretty wide range of severity in pancreatitis and acute pancreatitis. Most commonly, people will have a very mild form of pancreatitis, about 95% of the people. And for those people, they're ill for a few days. Often they get admitted to the hospital. We give them IV fluids, and this will usually resolve on its own without any consequences for the patient. We usually try to support them during this time, and we try to do a limited workup, including history and physical, to identify the cause and reverse it if we can. Now, 5% of the people will have a more severe form of pancreatitis, and for those patients, when they first present, they can be very ill. They get what's called a systemic inflammatory response that can cause a very rapid heart rate, fever, and even organ failure like respiratory failure, where they have to go on the ventilator, or renal failure, where they stop making urine and they need to have dialysis even sometimes. So for those patients, those are the ones we admit to the ICU. We aggressively resuscitate them, and then we do imaging studies to see if there's complications of pancreatitis. The main complication of pancreatitis that we worry about is what's called necrosis of the pancreas. That's where part of the pancreas actually dies. And for those people, they can develop in the long run pancreatic insufficiency, where they get diabetes or exocrine insufficiency, problems with digestion, but also they're at risk of developing fluid collections, or worse than that, infection in the pancreas, what we call infected pancreatic necrosis. And so for those people, we usually like to determine kind of on a multidisciplinary basis what treatment is actually best, but they usually are going to need aggressive IV antibiotic therapy and some sort of drainage procedure. Now, the drainage procedure is something that can be done either in radiology, or sometimes by an endoscopist with a scope, or sometimes even surgically. And when we do surgery for that, we have options of either doing minimally invasive surgery, or sometimes we have to do open surgery. And so for those patients, they can be very, very ill. It requires a team of doctors who have experience in managing pancreatitis, and it may be many, many weeks or even longer until they're better. But we have a team here at Niagara Falls Memorial that's dedicated to the management of these patients and getting them through their disease process.